So if you are a parent that thinks your child might have ME/CFS, and I know that there are time frames often involved. So when for my son, there was a period of time where we discovered he had cytomegalovirus, so we believed that it was just him dealing with that to begin with, that he should move through because it's much like glandular fever. However, there was a point when we started thinking this could be ME/CFS, but we didn't have a set diagnosis. Are there some things that we should or shouldn't do as parents of a young person in this time when you're wondering if this could be the case?
Absolutely, I think there are, and largely this is from my own experience and the things probably I didn't do that I should have done or I started doing sort of partway through the illness. So one of them, I think, is if you suspect that your child may have ME/CFS, is to start a daily diary and just keep a record of what happens every day during the illness. I mean, as Tom said, is know the core symptoms, severe fatigue, the brain fog, which is, of course, that the first time I heard that was when my daughter used the term to me. She said, "I've got brain fog." Now it's the common term for the sort of loss of memory, inability to just compute in the way that we normally do. My 14-year-old daughter wrote poetry and was a great little writer, and she couldn't write. Knowing, that the effect on sleep, the need to sleep long. I think my daughter slept for 14 or 15 hours in theory at the first stages of her illness, and yet awoke as though she hadn't slept at all. In other words, it was unrefreshing. Hypersensitivity to the senses, sensitivity to light and sound. She had to live in a darkened room, and as a typical Kiwi male who used to want to bang in nails in the weekend when I was home, I couldn't do that for 3 or 4 years because it was like torture to her, just that noise. So be sensitive to that. Watching television, most young people, of course, glued to their devices and whatever, and yet with this disease, it can be quite difficult. The stimulation one gets from watching television. So that's a kind of a signal. So watch out for sudden onset of allergies. My daughter became allergic to every food item that she had, and my wife had to go through and just, work out was there a flour that she could possibly have without getting a massive swelling in her abdomen, and that turned out to be rice flour. So my wife designed a diet which she could actually have without too much effect. And she still basically has that diet 32 years later, I have to say.